The information provided on this podcast is for general information purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk.
Welcome. This is Birth, baby. Your hosts are Sierra Morgan and Samantha Kelly. Sierra is a birth doula, hypnobirthing educator, and pediatric sleep consultant.
Samantha is a birth doula, childbirth educator, and lactation counselor. Join us as we guide you through your options for your pregnancy, birth, and postpartum journey. Hey everyone, today we have Leonora back with us from Home Birth Honey here in Austin, Texas. And she is here to talk with us today about weight gain in pregnancy, which is something we get asked about a lot. So thank you for being here again.
Absolutely. It's my pleasure.
Excited to chat with you about this. I think I say that at the beginning of every episode. That's just how I start my episodes. I am excited to chat
We
with you
are
about
excited
this.
about all of
I
that.
am.
I'm also excited about this episode because it's just something I've been wanting to talk to lots of people about. So this feels like a great platform for that.
Yeah, I
I
love that this
agree.
one was your idea.
Yeah.
You were like, hey guys, I want to talk about it. And we're like, well, then we should do that.
Bring it on. Yeah, I love it. I mean, it's such a big topic on like every side of it. Like how much weight is too much weight, how little weight is too little weight. I know when I was pregnant with my second, I was super, super sick and I lost so much weight that I was so worried about her because I was so skinny and so sick all the time. And you were one of my midwives at that time, and you were very helpful in helping me figure that out. You're like, just eat butter on everything that you ever eat. And that helped actually.
I literally have a butter tattoo.
I love it so much. I still live by that rule, which maybe is not my best choice, but it's fine.
We just blame Leonora.
Yeah. Exactly. So we hear a lot of thoughts and opinions on what is normal weight gain in pregnancy from everywhere and everyone. So, you're eating for two, you need to eat more. You can't gain too much weight. Otherwise, you're putting yourself at risk. It's hard to lose later, blah, blah, blah. So should someone expect to gain weight in pregnancy? And if so, how much would be quote unquote normal?
Yeah, so that's a great question, and it's one that I get asked a lot. The sort of reigning theory is that you base it on body mass index. We all know that body mass index is racist, it is outdated, it is not a great way to really think about health in general, but it is a tool that healthcare providers use basically to put people into different classifications and to help them make choices. So based on if you have a normal, quote unquote, normal body mass index, the recommendation is that you gain between 25 and 35 pounds. If you're underweight, you're going to be gaining more like 40 pounds. And if you are overweight or obese, the recommendation is more in the 10 to 15 pound range. I don't talk about that anymore during my first prenatal visits. I talk a lot about nutrition and I talk a lot about how you move your body, because I think that the overarching message that I would love to get across doing this podcast is that we have all been brought up in varying degrees of exposure to media and social media. And I think all of us that grew up, in the 80s and 90s with the health food craze, with fat-free foods, with dieting culture, we have a lot to unpack as women, as people, as humans, and certainly when we get pregnant, there's a lot there. And I see women who genuinely are distressed by the idea of gaining weight during their pregnancy. So I think that, step one, unpack what you learned growing up, because so much of that was not evidence-based and was really based more on the economy of selling food versus people's actual health status. Um, all that to say, I love to really, really focus in on what choices you're making for your body, what feels good in your body, how it feels good to move your body. And we have a scale in our office, but I would say that maybe once or twice during the pregnancy, we might ask that you hop on the scale. But I always check in with people during their first visit to ask them, like, is it going to be triggering for you to get on a scale? Is that something you'd like to avoid? Sometimes people like to go backwards on the scale and have us read the number for them. You know, I'm not big on numbers when it comes to weighing people. That was a really long answer for your very
I
short.
love that answer. And within my first like year and a half or so, so I was fairly new doula, I had a woman want to interview with me, and I think she had seen me on social media. And she lived in my area, and we were on the phone. She like cold called me, and she was one of her questions for me was, "Is it going to bother you that I'm fat?" And I immediately said, "No, is it going to bother you that I'm skinny?" Because, like, in her eyes, I would be skinny. And she goes, "No." I said, "Cool. I don't care if you're fat." She's like, "Great." Because I really am worried about how I'm going to be treated about being fat while I'm pregnant. And my doctor's already talking about it. And this whole pregnancy, she was so worried about that. And can you imagine what an awful feeling to hear that you're only supposed to gain 10 or 15 pounds in pregnancy because your BMI is whatever it is? That's almost impossible.
Yeah, let's talk about how much a baby weighs and all of the
Yeah.
fluid and all of the like
Yeah.
So
extra
you're supposed to
blood.
lose weight in pregnancy,
It's
is really what
predicated
that means.
on the idea that anybody with an elevated BMI has that because of lifestyle choices that they're making, not
Yeah.
based on what their genetic makeup is, what their hormones are doing, how their body reacts to different foods. It's incredibly reductionist. And um, I will say that, you know, I worked at a large, busy birth center for a decade, and it was a great experience, and I learned so much. And because that birth center was its own apparatus and it had so many moving parts, it had to have a very specific risk assessment that it adhered to in terms of what types of clients they could take on. And
Mhm.
so part of that was body mass index. And so we would need to talk to people about their weight when they reached out to us. At the point that they had just found out that they were pregnant, we had to ask them questions about their weight or call them and tell them that they were not a good candidate for birthing out of hospital with us because of their weight. Um,
And then
it
they're afraid that it's unsafe for them to birth out of the hospital at all because that place didn't accept them as a client. We have that happen with people all the time, and it's really as a hard pill to swallow.
it
It makes
is.
me nauseous thinking of you having to call someone and talk to them about that.
Yeah.
Yes. And I will say I, in my, 20s and early 30s, had not done a lot of work around this and was not aware of fat phobia and body stigmas, and, just sort of took it part and parcel as working there. It didn't feel good to have these conversations, but I was like, well, it's just about safety and about health. But in this life, I have done a lot of self-education about like what it actually means to live in a fat body, what it is to have an elevated body mass index, and the way that your healthcare providers respond to you, and the incredible stigma. I think it is so cool that that woman who reached out to you just put it out on the table and who was being self-protective in that moment, because I know that there are so many birth workers out there that do have intense feelings about people's bodies that are based on their own feelings and not based on, like actual medical evidence that people in larger bodies have, more adverse health outcomes. Now,
Yeah.
there are ways in which bigger bodies gestate differently and give birth differently. I'm not saying every single body is exactly the same and it's going to have the same pregnancy and you should eat exactly the same. In fact, I think the longer I'm a midwife, the more my response to everything is everybody has different bodies. That's just that's just the baseline, as we
For
all.
every subject.
Yes, literally everything, postpartum, everything. We all have different bodies. So there are different ways that I'm going to counsel somebody in a bigger body about, like what choices they're making and how they feel. But that does not put them in a higher risk category. So, when we're looking at weight gain during pregnancy, I just, now, if somebody is struggling to keep weight on and struggling to keep food down, I mean, that is a moment at which taking weights can be helpful, because if you are losing a ton of weight, that's a metric that we can keep track of that.
Be
But
a
I will
symptom of
say,
something larger too.
yeah, absolutely. I'll say though, the longer that I do this, the more I just feel that asking people specific questions about like what they're doing, how they're feeling, how certain things are making them feel, and just like troubleshooting the minutia of it is much more helpful than focusing on a number on a scale.
Yeah, we
Love
often
that.
have families who some of them switch from OB care over to midwifery care. And one of their first comments about their first appointment was always like, wow, they asked me like real questions about my specific situation. Like, that was really cool, you know? I had one dad recently go, they finally just gave my wife what she's been wanting for all three of her pregnancies. She finally got it with midwifery care. So I think that, of course, the weight gain, the numbers, all of that, people want to know the numbers, but really, is there like a too much or too little? So can not gaining enough weight have a negative impact? If you are somebody who's sitting there counting calories and has a really big issue with gaining weight, you don't want to gain weight.
Yeah, that's a bit more of what I see these days. I think back in the day it was more that like reigning idea of like eating for two, and you have to like kind of remind people that the person that they're eating for is like the size of a lentil, and then like the size of, a lime or
Really
something.
hungry lentil.
Yeah, exactly. Yes, you do need to support that gestation, but it's not a ton of extra calories. But now people are really, really conscientious about that. And so, a lot of times if you ask somebody, how are you eating? They'll be like, great, now I'm getting tons of protein. And then you check in and you ask, okay, like, you didn't feel like you wanted to do the diet recall that we offer at the first visit. So why didn't you just give me like an average day, breakfast, lunch, dinner? And they're like, well, I make some eggs for the kids, and I probably eat like one egg off of their plate in the morning. And then, sometimes I skip lunch, and then I always have dinner, and dinner's like meat and veggies and a carb. And I'm like, okay, you just described like maybe 600 calories. So we need to do a full breakfast. We need to talk about snacks. We need to talk about how to keep your body, feeling well during your pregnancy. It's just everybody eats so differently, and the way that you eat is so personal, and for some people like quite emotional, and then also cultural. We all have like culturally different ways that we eat. So part of your job as a midwife, or anybody who's going to be helping people make health choices, is to make sure that you're aware of those differences and that you can speak to that, but also be able to like do the math and do the work to dig in when somebody says, yeah, I'm eating great. Be like, how often do you eat dessert? And they're like, well, only a few times a week, but like, I have like a bowl of Fruit Loops in the morning and a bowl of Fruit Loops before bed. And, you can kind of
Hmm.
eat out these things that they find to be really normal, but that you're like, oh, that's not actually going to serve you during this pregnancy as much as you think it will.
Yeah, I think I just remember how I felt when I was as thin as I was in that pregnancy, and I was just tired. It was hard because I didn't have enough, my body was not getting enough fuel to fuel me through my life with a 2-year-old and a pregnancy and everything else that I was doing. So I knew that I needed more, and that's why it was helpful to have that care of, okay, well, what can we do? Like, what little things can we add in to help get you where you need to be? And I mean, really, that's what it comes back to. Like, we talked about this in our pre-Zoom meeting a couple weeks ago. Like, baby's gonna take what baby needs, but you are gonna be the one to suffer for it.
Yeah, this is a big idea I think that people have about pregnancy and about breastfeeding, that like your intake is going to have a huge, huge effect on baby's growth. And if you become truly malnourished or dehydrated, yes, absolutely, that will affect your baby. But if you are just chronically underfeeding yourself in a way that is, more or less sustainable, but not ideal, your baby will develop normally and you will feel like absolute crap. They
Yeah.
are, we say, perfect parasites. They're
Yes.
just really good at sucking the life out of your bones while they're in there and when you're breastfeeding. So of course, sometimes it's helpful to explain to people that, like, yes, this is also supporting your baby, because they won't do it for themselves, but they'll do it for baby. But
Mhm.
it's so much about the mom and about her well-being and like emotional well-being. When we're underfed
Yes.
emotionally, we do not feel well. We need that
Mhm.
glucose for our brain to run.
Yeah, that brain
Yeah.
fog or like pregnancy brain, it's like, okay, well, but are we getting enough fats? Are we getting enough, bits of sugar throughout our day, through food? I think that that is the biggest thing is that people aren't realizing like, oh, good. Like some people are going to listen to this that have an unhealthy relationship with food and they're going to be like, ha, the baby is going to get what they need and it's totally fine if I'm depleted. Like they almost want that. And I know that that sounds awful, but like I've been somebody who has that kind of mentality before, so I get it, not about the baby, but in general in life, like if I can survive.
Yeah.
And I think that the problem there is that they don't realize it all, if you want to have it come back to baby, it all still does. Because how good of a parent are you going to be able to be if you are so depleted in nutrition and you're postpartum, you're having to heal after having a baby and you're trying to produce breast milk for having a baby and you're not getting as much sleep because you have a baby. And then you're
Mhm.
also not having that nutrition, you're not going to heal very well. Your patience is going to be thin. I think that's where people don't see that it's going to negatively affect them. And that is very true.
Absolutely. Yeah, it's that old adage, put your oxygen mask on first so that you can help those around you. And I think as moms, like that is triply true, because, the whole family is kind of on a fulcrum around you. And so if you are depleting yourself intentionally or unintentionally, you're going to be functioning less ideally. Your family is going to be functioning less ideally. And you're going to be setting a template for your children to show them that it is okay for mom to come last, for her to be
Right.
the last person served, the last person to get free time, the last person to bed. Like that's what they're learning from you. And that's not cool.
Yeah. So, is there any like actual, issues that could come up from you not gaining enough weight, like with mom's health status or anything?
Yeah, absolutely. I mean, I don't focus as much on the weight. It's more just on like what, calories in, calories out. Like what are you putting
Right.
into your body? And if you are undernourishing yourself, not getting enough protein, not getting enough fat, not getting enough calories, you're going to be putting your pregnancy at risk for growth restriction. You're going to be putting yourself at risk for a preterm delivery, because if baby's not getting enough calories on the inside, they're going to look to come out on the outside where they can catch up on growth. I would say preeclampsia is something that is not completely understood, but they are starting to understand more about it. And I do think that for moms that don't get enough protein in their diet, I really do see an uptick in the likelihood of preeclampsia. Um,
Hmm.
I also think you're less likely to be sleeping well. And then also, your hormones are fat soluble, so you do need some fat on your body to be able to comfortably gestate a baby and go into labor and have all of these hormonal responses that are normal during
Hmm.
pregnancy. And I actually, when I was pregnant, I was talking to the old owner of the birth center. She was this kind of funny old school midwife, and she was like, she didn't know not to talk about body. She's like, look at you, you haven't put on any weight. And I was like, have you seen my butt? Like, she's large. And she was like, oh, you know what? That's just your body storing blood. And I was like, you know what? Like, because my thighs had gotten bigger and my butt had gotten bigger, and I was like, that is so comforting to me to think of like all of that extra blood that my body was storing. Because we all know that with birth there is a physiologic amount of bleeding that happens, and it can be up to 2 cups of blood. That is still, pretty much within the range of normal. So the idea that all that extra blood was just like hanging out in my body, getting ready for birth, I just found that to be so comforting personally.
Cracking
I
me
love
up
that.
because I love that that was comforting for you. And if someone told that to me, I'd be like, "Ugh."
She'd
Like
die.
my wrists would stop working. I'd have to sit down. That would be so gross for me to hear that my blood was in my butt. I love that so
I
much.
was just like slapping my hindquarters, like, yeah,
There
that's
it is. That's what's there.
You're right. All that blood jiggling around back there. I like it.
Oh my
So,
Lord.
what about the opposite? What about, are there any health risks to gaining too much weight during pregnancy?
fine. So I have served moms who have lost weight during their pregnancy, who maybe started out on the higher end and made some like big life changes while they were pregnant and just kind of slowly, plateaued and lost a tiny bit. And that worked out for them. Again, it was based on choices that they were making, not based on the idea that they were like dieting during their pregnancy. And I have helped moms who have gained up to 100 pounds during their pregnancy. Um, I don't think that gaining that much weight makes anybody feel particularly good in their body usually, and it's usually based on again, that idea of like eating for two, kind of like forcing yourself to eat maybe a bit more than needed. Just to go over the recommendations in the first trimester, I believe, are an extra 125 calories per day. Second trimester in the range of 250 calories per day, and third trimester around an extra 300 calories per day. It's
Breastfeeding, an extra million calories per
Yeah, it's
day.
breastfeeding is an extra 500 calories per day that I would take every day in these like giant sugary protein bars. I was like, I need this. Um, so yeah, your actual nutritional needs do not increase significantly for pregnancy. But what does increase is your need for high quality food, and especially for protein.
Mm.
Most of us do not get enough protein in our diets. I'm entering my perimenopausal years, and I'm working with this amazing midwife named Heather Satterfield, who is also a nurse practitioner. And she has helped me to remember, which I should know as a midwife, how stabilizing protein is for our blood sugars. So really, we ask that our moms be shooting for 80 to 100 grams of protein a day, which when you tally it up, unless you're just going ham, pun intended, on meat, most people are not hitting that goal. So
I'm not pregnant and I'm working with a functional nutritionist and I'm sitting here trying to get more protein like they're telling me to. And y'all, I'm full. I'm really having a hard time eating the foods I want to eat because I'm sitting there trying to get the protein in first, and that is a job.
Yep. It's hard. It's hard. And I recognize that. I really remember being pregnant and being like, this, I do not want to eat meat and veg. I want froyo, like straight up. That was what I wanted.
Hmm.
But I will say that the one thing that does not serve us during pregnancy is sugar. Sugar has a really not ideal effect on our health non-pregnant, and especially when we're pregnant. We really need to be looking to our metabolism to avoid gestational diabetes, and to also just not be putting your baby at risk for issues with insulin.
Mm.
So because of that, I always tell people, like, really focus in on the protein, because just like you said, when you're getting enough protein, you're not really thinking about sweets anymore. You're just really full.
Mhm.
Um, but also fiber. Fiber is really important. And if you're eating lots of fruits and veggies, lots of whole grains, you're probably doing great with fiber, but not all of us do that. So you do need to be, keeping an eye on fiber as well. If you're kind of focused on protein and fiber, you're probably doing fine. I'm not worried about people having a dessert here and there, or, a evening ritual of maybe some dark chocolate or a sweetened yogurt or something like that. But there is so much hidden sugar in the American diet, that if you are not cooking your own meals, you are likely having a ton of sugar added to everything that you eat. Really, one of the biggest things that you can do to help your health, in general, and especially when you're pregnant, is to make your own meals. Really, where we go off the rails is when we're buying pre-made food or food that's made at
Mhm.
restaurants, because there's just no eye to nutrition unless you're really bougie and buying from super high-end places. They're all about the health food, which if you can afford it, kudos to you. I can't. I have to like make my own food mostly. But that's okay. That's
Yeah.
a good practice.
And I think what's
Yeah.
important about what you're saying too is to remember that when Leonora is saying all of these things, it's because of how this is going to make you feel, how it's going to make your body react. Again, not because of how much weight you are gaining. I do want to touch on, you said that, like, we asked you about the gaining too much weight. The biggest thing that we have complaints from with people who gain more weight than they anticipated isn't how they look, it is how they feel and their
Yeah.
mobility. And then in labor, they're like, my thighs are giant. Like, it is so much harder to move my body right now, and they had all these things they wanted to do, and they wanted to be on all fours and whatever, and they're like, I feel like I can't even move in my own body. So
Yeah.
putting an emphasis on that, I think, is really important. And you said that the BMI was like a consideration, as a risk factor, for example, with the birth center that you worked at and things like that. Can you explain the why behind that being a risk factor? Like, what the thought process is there?
Mhm.
Did you already? Maybe you did.
No,
Dumb it
no, I,
down for us.
I didn't. The idea there actually is relates to what you were just saying. The idea is that, um, when you're birthing out of hospital, mobility counts. We need to be able to, if you're in the tub and, the baby's head delivers and we're trying to get those shoulders to deliver, and the shoulders are maybe a little bit sticky, quote unquote. And we say, hey, I need you to get out of the tub right now. I need you to, step out of the tub and get over here to the bed. Um, I need to know that the person that I'm asking to do that is going to be able to move when they are that pregnant, when they are in labor. And then the other thing, the one thing that actually is incredibly important when it comes to that, is to be able to hear fetal heart tones with a Doppler. We all have a layer of fat on our tummies. That's totally normal. But if that layer of fat gets too thick, the Dopplers that we use out of hospital to auscultate fetal heart tones, they don't pick up on heart tones as easily. So we do need to make sure that when we come in for those heart tone checks, within reason, it's not taking us a long time to hear baby. Um, so that's why, again, in somebody, who is fat or who has an elevated body mass index, I want to know, like, are you exercising? If so, like, what does your exercise look like? How are you eating? And a lot of times people will come to me and they'll be like, I'm a weightlifter. Like, the reason that like my body mass index is so high is like I have a ton of muscle on my body. And that typically plays out that, yes, they are just like a super solid, strong human being, who, has maybe like bigger bone structure. And that is, why they are higher on the body mass index scale. Um, Once in a great while, I'll come across somebody who genuinely is struggling a little bit with their mobility and maybe does have that layer of fat on their stomach that makes it hard to hear fetal heart tones. So that's going to be the main issue. There is a increased risk of gestational diabetes. There is an increased risk of hypertension. But guess what? We're screening for those things. So
Right.
the risks associated with gestational diabetes decrease almost to nothing when that gestational diabetes is diagnosed and when it is treated appropriately. So if you've got gestational diabetes and that person is managing with diet and exercise and they're being followed by a maternal fetal medicine doctor and their blood sugars are staying in a nice normal range, that's a low risk delivery. We're doing those deliveries at home. If we have somebody who did not test for gestational diabetes and we have no idea, that's not as low risk because we don't know that that baby might have some issues after they're born. Um,
Right.
we're checking blood pressure every time we see somebody and multiple times during labor and during the postpartum period. So if they have hypertension, guess what? We're going to know. So yes, there are risk factors associated there, but they're all screenable. Nothing is a mystery. We just need to make sure that that person is going to feel really good in their body, birthing at home or in a birthing center, just being able to move.
And those things exist in the hospital too. People who are, I guess what they would call like morbidly obese on, the much larger side, it's harder for them to monitor baby when they're trying, even like with inductions and stuff. I see different kinds of monitoring being necessary in those situations, like internal monitors, because they're not able to monitor externally in the same way. So it's not just something that we see at home. This happens, everywhere. And, there's different things to be considering and discussing with providers, if that is your story.
For sure.
So I struggled in pregnancy with severe morning sickness, and that was why I struggled with my weight so much. And, like I said earlier, that was really difficult for me to kind of wrap my mind around, like, is my baby going to be okay because of all of this? I was afraid, I would develop blood pressure issues and all of these different things because I knew too much. So can those things, severe morning sickness or even more serious things like hyperemesis, have a role on weight and pregnancy? I mean, obviously they do, but are those something that you're quite as concerned about as just like, diet restriction?
So there's morning sickness, there's severe morning sickness, and then there's hyperemesis. Um,
Hmm.
Morning sickness is really normal. I would say most pregnant people are going to experience, at least some nausea, maybe a few bouts of vomiting. Then there's severe morning sickness where you're throwing up all the time. Maybe it's not really going to clear up by 12 weeks. Maybe it even lasts till 20 weeks. And then there's hyperemesis where you are vomiting uncontrollably. You maybe are going to the hospital for IV fluids. You need to take drugs to keep your foods down. Hyperemesis really takes a normal pregnancy and puts it in a different risk category. But if we're just talking about morning sickness, there are a lot of workarounds. We always have the recommendation of eating frequently, like even just like a handful of almonds, cracker with cheese, an apple with cheese, really small things every few hours help to keep your blood sugar steady, which are going to help to, decrease the nausea so that you're able to keep food down. But if we have somebody who is throwing up daily, who is losing weight, who is, maybe keeping down one meal a day, maybe two, um, we have medicine at our disposal now in this day and age. And is it completely, absolutely 1 million% risk free? No. All drugs have side effects, but the drugs that we're able to prescribe are considered low risk enough that the benefits outweigh the risks during pregnancy. So for those moms, I find that starting them on, if possible, IV infusions, and especially IV infusions with Zofran early in the pregnancy, can be super helpful to get them on the right track so that it never gets really bad. Because once it gets really bad, it's almost like a negative feedback loop, and it's just really hard to get back to the point where you have like any normalcy with your digestion. So for those moms that, either don't want to take the meds or kind of just in a gray area of like, maybe just not quite bad enough, so to speak, to take the meds, you can do your little workarounds to try and keep your food down. But ultimately, if you're losing a lot of weight, we do really want to make sure that we're trying to take corrective measures to keep you well, and to, just make it so that your pregnancy is not miserable is kind of one of the main things.
Yeah, I had a client who, gosh, this was in my first year or two, had severe hyperemesis to the point where she was on a Zofran pump at home. And it was her second pregnancy, and her first child was like 3.
Hmm.
And she was saying things like, Mommy, it's okay. I'll make my dinner. And like going into the freezer and opening it, like it was so depressing and sad. And she was like, I am getting induced on my due date because I can't do this for one more minute of one more day.
Yeah.
And so she did, which happened to be my daughter's birthday, which was kind of fun. So we go, and she was tall and kind of like a ballerina's body. She used to be a ballerina, and we called her a baby smuggler afterward because she looked about 5 months pregnant when we walked in. I mean, everyone was like, "Holy cannoli, this chick is real thin." Y'all, I just want you to feel better if you are out there with hyperemesis because she had a 9 pound, 3 ounce baby in there with
Wow.
hyperemesis that entire pregnancy. And
Wow.
it's really difficult. Like, it's at a point where, yes, of course, there are risks to the medication, but like, are you surviving?
Mm.
Because we had a doula on our team who used you as her midwife. And it was her fourth baby, first home birth. She was so sick. She sent me a picture. She didn't even look like herself. She had the darkest circles under her eyes. No one was listening to her before she hired y'all. She hired you, and you were like, you do not have to live like this. And it changed her, like having that support from your provider, because some just think, well, this is something you have to endure. And there is a
Oof.
risk benefit analysis to do there. And it's okay if you make the choice to take a medication to help you survive.
I think that when it comes to disorders and diseases that affect 100% of women or birthing people, people with uteruses, they're very understudied. Like look at hyperemesis, look at menopause. Anything that affects somebody with a uterus is going to be way less funded, way less understood, and way more prone to having healthcare practitioners be like, well, it's a finite amount of time, you're going to get through it, it's fine. But that is whack. So yes, if somebody is hating their pregnancy for any reason, for nausea and vomiting, for psychological issues, we are very much in favor of collaboration of care. We have psychiatrists that we can refer to if somebody needs medications that are safe to take while they're pregnant for their mental health. And of course, we have maternal fetal medicine doctors who can do infusions and prescribe Zofran, or Phenergan, or all sorts of different meds to help keep you on the right track. I think that that's just it shouldn't even really be questioned. But it's for some people it's just a personal preference thing. Some people just really are like, I won't take medicine unless I'm dying, and I'm
Yeah.
like, you do you, babe. We'll just
Yeah.
see the options that are available.
Yeah, there's definitely a culture of women just have to suffer when they're pregnant, and once you're through it, then you can treat whatever it is that's coming up. But it's definitely not the case. I actually listened to another podcast episode by the Midwife's Cauldron, which is one of my absolute favorite podcasts out there. And they did an episode on pregnancy sickness and had a researcher, Professor O'Reilly, I think is what his name is. But he's doing all of this research on pregnancy sickness and hyperemesis and medications that can help with it, and like things that you can do pre-pregnancy if you had hyperemesis and another pregnancy to prevent it from happening. And it's like really cool stuff. And I really can't wait to hear what is going to come from that, because it's insane that we are in 2024 and we've just now started to figure out that there's like, oh, you could take some Zofran, or you can take some Dislegis, or whatever, Unisalmon B6, whatever it is that's out there. We're just now figuring that out. So I don't know. That's crazy. Um, Speaking of medications, though, kind of my last little question here. We hear on anything everywhere, radio, television, TikTok, everywhere, about Ozempic and other weight loss drugs right now. And actually, on Saturday Night Live this week, they had a sketch in their weekend update that was about Ozempic babies. And I've been seeing this all over TikTok too, about people getting pregnant on Ozempic. So what do you know, I guess, about the research showing about weight loss drugs and how they might be affecting fertility or pregnancy or whatever else?
Yeah, this is something I'm so curious to see where the data takes us, because it's obviously a newer drug, but hit the market like a ton of bricks. Obviously, like people are super into it. And, you know, I think that when it comes to making choices about our own bodies, like I have zero judgment. Like if somebody found that drug to impact their life in a beneficial way, and, you know, maybe they had a weight loss goal and they hit it and they feel better, kudos, that's great. It seems like the mechanism by which people are potentially getting more pregnant while on Ozempic, I believe, is by weight loss. Like, you know, sometimes when we are heavier, it's harder for us to get pregnant. But it does have an effect on our insulin resistance. And so I am really curious to see, because I think that, you know, if a lot of people are getting pregnant while they're on Ozempic, we'll start to know within the next few years or so, like if that does have effects on the baby's insulin resistance. And, you know, if we are looking at a pregnancy that, you know, in the rebound effect of getting off a med like that, that they're more likely to have gestational diabetes. Because we all know that when you diet or when you take a med to lose weight, you know, there's the maintenance phase, and then you get off of it and it rebounds. You know, it's not ever just like we lose weight and then it just stops forever and we can just go back to eating carbs, la la la, you know. So yeah, I don't know. I'm very curious about Ozempic, and you know, it's just coming from a place of curiosity, not of judgment. But I do wonder what these pregnancies are going to look like and how these babies will do.
There's definitely going to be some questions, and I'm sure answers are going to come up over the next, couple of years. It feels like it really did just blow up. Like I'd never heard of it before, and then now it's all anybody ever talks about. Like Kelly Clarkson, Whoopi Goldberg, Melissa McCarthy, like all of these women that are losing, crazy amounts of weight are doing it with the help of these weight loss drugs. And then we're hearing from other women that they're getting pregnant while on these weight loss drugs, accidentally or on purpose. And it'll definitely be interesting.
It's
Yeah,
hard because there's not enough time that's gone on. So we don't know much yet. And so it's kind of like this generation of people is the guinea pigs of what this is going to do. Um,
Yeah.
you know,
when it comes to the history of weight loss drugs, when you look back over the years, as to like the types of medicine that have been prescribed with absolute impunity to all sorts of people, um it's not pretty. I mean, you know, fen people were dropping dead of heart attacks and they were like, well, you know, maybe it's not the
Maybe we
safest
shouldn't have
thing.
done that.
Yeah, yeah, you know, it's crazy. And like prescribing weight loss drugs, you know, I could talk about this all day, but like to children, the idea of like children losing weight, like
Yeah.
it's a lot. But yes, that will certainly be an interesting thing to find out about in the future.
When all the research studies come out in, 2025 and 2026, we'll do a whole other episode just
That will be
dissecting them
all
all.
absolutely. What I'm waiting for is the COVID data. I want to know about like COVID effects on pregnancy and
Hmm.
placenta and the baby and the birth and the blood clots and all of that. Like, I'm like, where is the data? I want to
I
know.
Samantha is
know.
your data queen right there. She's been dying for that too. So
I'm dying for it. I'm so ready
You know
because
what?
I see it. We
I'll
see
do
it.
this while
Yes,
y'all talk on that one because I'll just be listening to your brains.
I want to know. I'm like
It's gonna be
gagging
great.
the data, as the kids would say.
It's just interesting. It's cool to learn about. It's not coming from a place of judgment. It's
Right.
just this is our bodies. Like this is the world that we're living in. We're experiencing all these crazy things, and it's cool to see what it's doing, why it's happening, how it's going to affect future generations and, whatever else. I think it's a really interesting aspect of being a human. So
Yeah.
anyways, thank you
All
so
right.
much for coming on and having this really important and slightly chaotic conversation. I think it's important, and I think this is helpful for people.
Yeah, I
Yeah.
think if one thing I would love to conclude with, it is that if you are getting blanket advice from your healthcare providers to lose weight in response to things like getting a UTI, having an ear infection, you know, anything, you need to find a new healthcare provider because that is a outdated mode of thought, and it's actually dangerous because people in larger bodies are less likely to get healthcare because of these reactions. So
Yeah.
If you're trying to get pregnant or you're pregnant and your healthcare provider is, making a big deal out of your weight, despite the fact that you are making great choices for your body, you might consider finding someone else.
I love
Yeah.
that. Yeah, thank you so much. And we are going to be doing more episodes with Leonora because we love her brain, and we will have her back soon. So thank you so much.
Yay, thanks.
Thank you for joining us on Birth, Baby. Thanks again to Longing for Orpheus for our music. You can look him up on Spotify. Remember to leave a review, share, and follow wherever you get your podcasts. See you next week.